she is currently at the Castina State College of Health Science and Technology, Daura, Castina State. So her topic is mobilizing the community for healthy living. Ms. Halima, over to you.
Yes. Good morning, everybody. Good morning, lead mentor. Our rapporteurs in the house. Good morning. I welcome you all to this presentation. Without taking much of your time, I would like to start my presentation. And please, Mrs. Watu, I would like you to share my slide so that our audience will see what I have. Let me start presenting. Mobilizing the community for a healthy lifestyle. My presentation outline, I have introduction, steps in community mobilization, taking action, the action itself, begin your mobilization by, the steps followed, conclusion and references. So my next slide will be the introduction. Community mobilization is a process of bringing the community together for adaptation of a particular orientation on beneficial health interventions in preventing and promoting good health and a healthy lifestyle in the community. The steps in community mobilization, next slide please. The steps in community mobilization, you can begin planning your community assessment and to plan future interventions by, number one, interviewing and spending time with the community members, conducting listening sessions and public forums. Two, you can begin your community assessment by reading available relevant government reports regarding that particular community and the necessary interventions that are being required by that particular community, and contacting colleagues in other branches of your health department and other health department in your region. Next slide. Identifying and working with the community leaders and others involved in various disease elimination programs. This will provide you with a wealth of information about community diseases, prevention program activities in your community. Once you are planning for community mobilization, it is important to note that you cannot mobilize the community without involving the elders in that particular community, stakeholders involved, and the resource and available for that particular community mobilization. And once your planning for community mobilization is complete, you are ready to move on to the next phase of awareness raising and coalition or partnership building. In awareness raising, approaching a wide spectrum of community leaders, representatives of private foundations, state and local health coalitions, non-traditional and community leaders is very, very necessary and important. Then followed by identifying the key messages to attract the attention of the problem and its impact in the community. Is very, very important. This particular key is very, very important in community mobilization. Actually identifying the community needs and identifying ways in which the community will help themselves, because in community mobilization, the community actually has to be involved. 100% participatory is required by the community, using their resources, mobilizing them to achieve community mobilization for the progress of the healthy living of that particular community. Now the next slide, taking action. With your community coalition in place and goal and vision established, you are ready to move into an action and outreach. Yes. And as you develop and implement your action plan, keep in mind the importance of increasing the awareness and knowledge of your target audience and those at risk population about e.g. disease prevention and the impact on the community healthy lifestyle or healthy living. The action, in community health mobilization, number one, you have to schedule the initial meeting, invite individuals who responded and show interest in your mobilization, because you cannot do with people that don't have interest in what you do. You have to involve people that have interest in that aspect. And then number two, that is B, at the first meeting, determine your community mobilization goal. Yes, this one is very, very important. Your goal, your target to be met, you have to establish it and you have to determine it from your community. C, in the action, you have to determine why they will support the community for a healthy lifestyle or healthy living, and whether they have been involved in previous activities. You have to know from the community, because if you make inquiries about other interventions, how community mobilization was being carried out in order to carry out some preventive measures in that particular community regarding other diseases prevention or campaigns, the community will be able to tell you how they were able to do it and how they were able to achieve it. Then D, in the action, you have to assess findings for insight. Yes, have to assess findings for insight to shed you more light on the next step to take. E, ensure your mobilization is open and diverse and judges some key players. Yes, key players in carrying out community mobilization are very, very important. Like example, the people involved in the health sector, that is the health workers and the community leaders. These are the key players actually that you know will take an active role. Yes, definitely. Those that will help in bringing out and identifying the problems of the community and how the community will resource the mobilization, because we have to find out the resources available by the community to be used by the community for their own health benefits. Then F, in the action, you have to share the prospective members of the mobilization, share with the prospective members of the mobilization a copy of the community assessment. Yes, what you have done, you have to share it with the community members. A copy of the community assessment, community impact statement, and any other appropriate methods. All these things, you have to do it hand in hand with the community. By so doing, you create such a very, very good rapport with the community to be able to have to confide in you and then allow you to be active in any other community mobilization to come there with. Uh, then begin your mobilization. Number one, as how to begin your mobilization, you have to developing a strategic plan of action based on your community's needs. Yes, all your actions will be geared towards the community's needs. The plan should include specific steps, yes, specific steps, a timeline, and needed resources. Two, delegating the responsibilities evenly among community members. Yes, every member will have to be part of, will have to be part of the community mobilization. Participatory aspect is very, very important. And when members feel they are involved in carrying out anything that will benefit the community, you'll find out that they will deliver beyond your expectation. And then number three, identifying and preparing additional materials to be used. Yes, it is your responsibility as a healthcare worker or the key player in the community mobilization to be able to identify and prepare additional materials to be needed or if needed to be used in carrying out a successful community mobilization. Number four, implementing actions towards the key target audience. Yes, putting all the plans into action. Other community organizations as well as those at risk population, because at times when we venture into community mobilization, there is certain targets set to be met and there are certain target audience that we are looking up to. There are people that we wanted to carry out our awareness to reach. Those are the target audience or the people at risk. So we please, when we're doing community mobilization, we have to share our visions, our statements, and our feasible goals. Yes. So number 5, strengthening the community involvement and partnership. Yes, you have to make that bond between the community members to become very, very strong, and the partnership with the healthcare mobilizers or the NGOs in place. They will have to strengthen the community involvement in one way or the other. And we have several ways of making this strengthening of the community's involvement by maybe giving some stipends, some incentives to the community. That way we do it, we create the strengthening aspect between creating a kind of bond between the community and those that are giving the healthcare service, mobilizing people for healthcare interventions. Then number 6, developing health promotion materials and culturally competent interventions. Yes, this should not be overlooked when we are carrying out our community mobilization. We should be aware of the culture of the people that we are giving out our health and mobilization towards a healthy living. Culture is very, very important. We have to look at the cultures and the systems of that particular community, how they run the community, so that we shouldn't uh, reach or cut across some, because there are communities that when you are carrying out your health interventions and they find out that there are certain things that you will do that it will affect their culture, they will never agree to that mobilization. In fact, that is the end of their community mobilization. So be very, very sensitive of the community culture, and and uh, and have a very, very competent stakeholders in place that will carry out this intervention, having fully aware of the community skills, norms, and values. Yes, in mobilization, community mobilization, people, the stakeholders that actually goes into community mobilization will have to be very, very active in the community culture in such a way that the community will not see it as a way that we are trying to stop one or two of their culture, but some beliefs that are not good, we try to bring it to the highlight to the community so that they will accept our mobilization. Um, yes, the last one, to develop a shared vision, mission statements, and feasible goals. Yes. To conclusion, once a community is properly mobilized for a health action, you will be able to help them prevent the diseases of interest or promote healthy daily living. My references are here. Thank you very, very much. Without